Hi Buffett, I'm back again with another video, another story Buffett. This is your boy Simtemin. However, there's an article here written by Hope Mzansi. DA is continuing to be a DA, keeping ANC in check. That's why DA is good at keeping the ANC in check. That's why it doesn't need to be in the GNU. It needs to be out of the GNU. But anyway, I'm not a politician. DA demands urgent action as health sector faces staff crisis. The Democratic Alliance has issued a warning to Health Minister Journal Motswaledi, urging the immediate filing of thousands of vacant frontline health workers post health worker posts. Excuse me, urging the immediate filing of thousands of vacant frontline health worker posts to prevent what is called a looming public health disaster. And it's been years this public health decreasing. It's been years since the public work, the public health it's been in a disaster. It's been years, probably 15 to 20 years. Look, since democracy. According to the DA, the minister's recent announcement only a small number of advertised health posts is grossly inadequate, considering the scale of vacancies in the public health sector. This comes after Minister Motswaledi announced that the Department of Health has approved 1,200 doctor posts, 200 nursing positions, and 250 other healthcare posts at a job cost of 1.7 billion. Can you please hire South Africans, guys, first? Please, don't go first doctors from Cuba. Please. South African doctors need to be employed, South African people first. ANC. And stop and stop having ghost employees there. We're probably gonna have ghost employees, non-black people. And the corruption, man. Don't you feel ashamed as a black person? I wanna name like something Edwin Zod. His statements are followed mounting concern over the growing number of unemployed doctors, many of whom have taken to protesting in recent months. They told us, Tina, in the media. I started the media, film and media. So they told us that our courses are not important. Humanity is not that important. We need to focus on some serious thing like BSc, PCOM, and like some serious engineering. But there are engineers who are sitting at home. There are computer science students who are sitting at home. There are doctors who are at home. There are teachers who are at home. Like, what's going on? We are new. His statements follow mounting concern over the growing number of unemployed doctors, many of whom have taken protest in recent months. Civil society groups and professional bodies have also urged the government to urgently employ doctors who have completed their community service. Speaking in Pretoria last Thursday, Motswaledi said that the department had previously been unable to act due to budget constraints, but a new budget allocation by Finance Minister Enoch Godongwana has now made this post possible. The party welcomed the addition of new positions but condemned it as a mere drop in the ocean, emphasizing that this accounts for just a fraction of the total vacant posts that remained unfilled. The Democratic Alliance reinstates our urgent call for these frontline public health workers vacancies to be filled. Now, if Motswaledi want to avoid a looming public health disaster, he must act now, said Michelle Clark, the spokesperson on health. Right. The DA expressed deep concern over the simultaneous reduction in PEPFAR funded health workers, warning that the combination of international funding cuts and government inaction could devastate already overstretched health facilities. But the money apparently wasn't going to the health. 10% of the money that was sent for PEPFAR was going to the intended things. She pointed. Clark added, the minister announcements of just 1.5 health posts being advertised while 10,000 remain vacant is a travesty. Yo, this is too much, bruh. This is too much. Ain't see? This is too much. Mzwaledi, I'm not told you guys cut your salaries. Cut your salaries. How? You cannot get paid this much. You cannot be rich by working for the people. There's no way. Saving the people but to become rich, aye, then you're not saving the people, you're working for yourself. She pointed for she pointed to years of corruption and mismanagement in the Department of Health as the root cause of staff shortages, crumbling infrastructure, and failing services. The DA also criticized the government's focus on the National Health Insurance Project, calling it a fictional NHI promise and urging that funds earmarked for it be directed to fill critical staffing gaps. Aye. Mara, we might fight things, we might fight, guys. But the DA somewhere it has points, guys. That's why I want them to govern the country alone if they get that chance, not to co-govern when people have failed for 30 years. Aye. The DA also criticized the government for focus on national health insurance. Okay, funding which Minister Motswaledi is diverting to these NHI projects must rather be made available to fill shortfall in critical frontline workers now. Save lives now instead of wasting money on a doomed NHI, Clark said. During recent oversight visit to Sibokeng and Rahima Musa Hospital, the TA witnessed a first-hand the effect of inadequate staffing. Yeah, Baba, each and every hospital, come to our local clinics, you'll see, Baba. People stay there the whole day. During recent oversight visit, patients are left waiting for hours, often receiving little or no treatment as overwhelmed staff struggle to meet the overwhelming demands for services. Clark said millions of South Africans depend on the department to provide essential medical services, and the minister's inadequate action in the face of a crisis infringe on the rights of access to health care. Fill the vacancies now before it is too late for the people of this country who rely on public health care to survive, Clark said. Clark, they don't care, these people, bro. Clark, I'm telling you now, they don't care about us. They don't care about the population. They act like they care. They don't, or they don't have a clue if they care. Just mind your skin colors, guys, is wrong. Your skin color is wrong. According to our population, our people are scared to vote for the day because they view it as a white party. But anyway, guys, comment out below. Subscribe, Buffett. This is your boy Sim Temple. This is Mzansi Political Journal, Buffett. Continue supporting.